were based mostly looking at community settings, and others were looking at institutional settings. If we look at spinal cord injury, again, another forest plot. This is for spinal cord injury and traumatic brain injury. We mostly have incidence study because these are acute conditions, so we have new cases. But we're also interested in how many people are living with these conditions. And unfortunately, we don't have a lot of these data. We have a lot of incidence study, how many new cases are diagnosed per year, how many people. And what you can see in this first slide for spinal cord injury is that the incidence seems to be higher in North America. And why could that be? There are different reasons. Some of the studies that are included here include sometimes a bit younger population, more males, higher risk-taking behavior, diving injury, motor vehicle accident, and so on. And so those are some of the reasons why that is. There were only a few Canadian study, and the incidence was a little bit higher in Canada than the overall international average, so a little bit higher. This next graph here is to show you that this is not surprising. This was well known from the literature, but what you see is at the top are the average annual incidence of spinal cord injury per 100,000 people for women, and below is for men. And you can see, not surprisingly, as many of you I'm sure are aware, that the incidence is higher in men. And one very important factor when considering surveillance for spinal cord injury, and I apologize again, this slide is a bit off the screen, but what we found is that some studies include, if they look at how many patients sustain a spinal cord injury, they exclude patients who died before reaching the hospital. But clearly those